Good morning. Thank you for joining us. We are fortunate to be joined today by representatives from the Metropolitan Wastewater Management Commission and Eugene Eugene Water and Electric Board. Sorry. And at this time, I will invite the Metropolitan Wastewater Management Commission up to deliver their update.
Thank you, Jason. Good morning. The Metropolitan Wastewater Management Commission is a 43-year-old partnership between the cities of Eugene and Springfield and Lane County that provides high-quality wastewater services to the Eugene-Springfield metropolitan area while protecting our community's health and the environment. The regional wastewater treatment plant is a vital asset to our community that cleans water 24 hours a day, 7 days a week. Staff works around the clock to ensure that our state and community's water quality expectations are met or exceeded, that the wastewater collection system to the regional treatment plant is running smoothly, and to address any issues that may arise as trash items that are introduced into the system and cause blockages. We want to thank community members who are helping us keep the wastewater collection system running smoothly by practicing pollution prevention steps in their homes and businesses. These steps include only flushing the 3 Ps, pee, poop, and paper, that's toilet paper. Additionally, we want to stress the importance of not flushing items such as paper towels, tissue paper, fabrics made of materials such as cut-up t-shirts, diapers, or wipes, even if they say flushable or plumber certified. All of these items are not manufactured to break down in the wastewater treatment process and do cause blockages as the wastewater collection system travels the water to the treatment plant. Even worse, they can block the pipe from your home or business that connects the wastewater collection system and cause water to back up into your home or business, causing potential costly repairs. For our community members watching their on septic systems, these items should not be flushed as well. We understand that these are difficult times, and we are all adjusting to the state's stay home, stay safe order. The Metropolitan Wastewater Management Commission supports both the Eugene Water and Electric Board and Springfield Utility Board programs that provide help to those in need of assistance with paying their water and electric bills through annual direct funding or sponsorship. When the state's stay-at-home, stay-safe order is lifted, we encourage community groups, organizations, and schools to contact us about touring the regional wastewater treatment plant to see the cleaning of water in person. To learn more today, please visit mwmcpartners.org. Thank you. And now I'd like to introduce Joe Harwood with Eugene Water and Electric Board.
Well, good morning, everyone. My name is Joe Harwood. I'm the Public Information Officer for the Eugene Water and Electric Board. I want to thank Lane County for providing this invitation to reach out to our customers and the larger community. As the wide-ranging impacts of the coronavirus spread throughout our community, the Eugene Water and Electric Board is taking definitive actions to help and protect our customers and our employees so we can continue to provide reliable electricity and healthy water during this crisis. It is not an overreaction to say this is an unprecedented situation from a personal, public health, professional, and economic point of view. In times like these, where the circumstances seem to change daily, if not hourly, our ability to remain resilient and responsive will be challenged. The good news is we at eWeb remain on the job with multiple strategies to maintain essential services. Some of the actions we've taken to support customers in the past few weeks in response to the coronavirus outbreak include temporarily suspending service disconnections and late fees for customer non-payment. We've nearly tripled the bill assistance funding originally budgeted for our eWeb customer care program for limited income customers. And probably most significantly, we've expanded our customer care program to provide a $260 bill credit to any customer who loses a job or is laid off as a result of this coronavirus outbreak. I should say, unlike other assistance programs, the job loss benefit does not include an income threshold. All we require for that is proof from the Oregon Employment Department that you are currently receiving unemployment benefits. Finally, we've also allowed customers with residential and commercial energy efficiency loans to defer those loan payments for the time being. And despite all these proactive measures, the needs of our customers will likely outstrip our resources as the negative economic impacts continue to grow here in Lane County, in Oregon, and throughout the country. We're doing as much as we can, and we're still looking for ways to help our customers through this difficult time. In addition to help for our customers, eWeb has implemented immediate steps to keep your lights on and your water flowing. As a provider of essential services, our top priority is to protect public safety. To carry out this mission, we have to protect our workforce so we can continue to provide those essential services of reliable electricity and healthy water. Some of the steps we've taken in the past few weeks for business continuity. Initially, we had as many employees as possible work from home, and that was later turned from a request to a mandate. That was to limit potential virus transmission. For those not equipped or able to telework, we have modified their assignments. We've staggered shifts to keep our crews apart to prevent virus transmission. And we're rotating our on-call crews so that eWeb is able to keep individual crews, both on the water and the electric side, healthy. We've also limited our reliability projects to avoid planned electric and water outages because so many of our customers are at home with children because of the school closures, they're teleworking, or they've been laid off. eWeb crews continue to perform vital work such as repairing or replacing failing equipment to prevent unplanned service interruptions. We are making sure that our staffing is on par to perform new water and electric service connections as needed, including emergency requests for medical or public health needs. And while we closed our customer service lobby to the public in mid-March as a precautionary measure, our employees continue to staff the call center and reply to emails from 9 a.m. to 6:30 p.m. Monday through Friday. All of these measures are intended to focus eWeb work activities on the most essential functions to keep the lights on, the water flowing, communicating with our customers, and maintaining the enhanced assistance programs as long as possible. These are difficult times for our customers and our employees. Be assured that eWeb will do everything possible to help the community through this crisis. Now I'll turn it back over to Jason.
Thank you, Laura Lynn and Joe, for your messages, and certainly on behalf of the entire emergency response for COVID, thank you for keeping the lights on and the water flowing. And also, thank you so much for making sure that those people in our community who are economically impacted by COVID have a way to do the same, keep the lights on and the water flowing. That's going to be fundamental in our ability to recover as well. So again, thank you, and apologies for fumbling eWeb's name. I'm used to just calling them eWeb, as I'm sure most people are, and as you start to spell that out, it can get tongue-tied. A quick update on our case numbers. We currently have 32 positive cases, and you'll notice that that hasn't changed since last night, so that's really good news. We also have 1,074 tests which have come back from Lane County to our various lab partners. We have 6 individuals who remain hospitalized, 7 individuals who have recovered, still holding at 1 fatality, and around 18 people are recovering at home. I would also like to just comment briefly about our case that we announced last night. That was an individual, a female in her 50s from the Eugene Springfield area. She is currently medically stable and at home. In the course of our contact investigations, we were able to identify an epidemiological link to Washington County. And so that's important in our disease investigations and really understanding how the disease is entering into Lane County, and then thankfully being able to really contain it with that one case. And so that's an important part of our communicable disease investigative process. Also, we've had a couple comments coming in from social media, people questioning, should you be talking about these numbers if the understanding is really that we don't have a full picture. And I think that is an important consideration, and we certainly appreciate people weighing in on that. Our thinking behind that was that while we don't have the full picture, and I think we've really tried hard to make sure that we communicate that fact, we do have some information, and that information can tell us at least how many people are experiencing severe illness in our community, who are being hospitalized, and some other factors. And so we think it's important to share what we do have. And so really that is going to be our approach going forward, and we do appreciate your understanding and patience as we try to get as much information out to you as possible. We do also have an announcement today coming from St. Vincent de Paul. As you know, they are our partner in helping us operate our respite centers that have really been an invaluable resource for our unhoused community and making sure that those folks have a place to go and uphold the governor's orders. They are in desperate need for clothing donations. They first went around to their various stores where they have clothing. And that has been safe. It hasn't been accessed for weeks now. And so they were able to go in there and sort of triage some of the clothing and be able to provide that to those shelters. But they're now reaching a critical limit where they need more clothing donations. And so we're really sending that message out to the public, asking you, especially for unused donations of men's and women's underwear and undergarments. Those are critical and in desperate need right now. It's also important to let folks know that as you bring those donations down, please make sure they're bagged or boxed. That will help ensure the safety of people who are handling those donations. And then those donations will actually go through a quarantine process where they will be isolated for a period of time, based off of CDC recommendations. Those donations will be able to be accepted at the donation center located at 201 Division Avenue. That's going to be starting tomorrow and will take place from 10 a.m. to 6 p.m. So please do bring down your donations, especially those unused undergarment donations for both men and women to that 201 Division Avenue location starting tomorrow. We will be having a live question and answer segment with Dr. Lysandra Guzman in Spanish on the Central Latino Facebook today at 1:30 p.m. And so in our course of this entire communications effort around COVID-19 response, we really identified a need to make sure that we are doing our best to provide Spanish-speaking resources. And the live sort of question and answer format has been something that we've done with Dr. Ludke. And so fortunately, we have Dr. Lysandra Guzman, who is fluent in Spanish and can do that for our Spanish-speaking community. And again, that's going to be on the Central Latino Facebook page live at 1:30 p.m. today. So please log on to that and you can have your questions answered. Also, I was talking to one of our communicable disease nurses earlier today about some of these cases. That's how I get the information for the press briefings, and she just really wanted to pass on a message to our community. She says, I think we have to get the message out of gratitude to the people of Lane County. When they are doing what they are doing by physical distancing and staying home is working. We see that clearly. Please send them a big thank you from all the public health nurses. So a direct thank you from those that are doing this important work and those contact investigations that really what our community is doing is working, and they really appreciate that. I'd also like to send our thanks to Metro TV. Those are the folks right here behind the cameras. They make these broadcasts available to you every day. They're a function of Lane Council of Governments, and have really stepped up and increased our ability to communicate with the public. So thank you so much to Metro TV. They have a Facebook page and a website where you can learn more about the many things they do for our community. At this time, I'll take any questions from members of the media. I will do the public health ones. If you have questions for either eWeb or the Metropolitan Wastewater Management Commission, I will then do those after we get done with the public health questions.
So Brian with KEZI would like to know whether there's truth to the rumor that hospitals in Lane County are running out of COVID-19 tests.
So Brian from KZI would like to know whether or not there's truth in the rumor that hospitals here in Lane County are running out of COVID-19 tests. So first I'll answer the question by saying we have never actually done testing, you know, in a large capacity where we would have patients coming into our hospitals and able to be tested here in Lane County. What's happening is the test samples are collected here in Lane County and then sent out to labs. There are supplies involved in the collection process which experience temporary shortages. So the things like the swabs that actually go to the back of the throat and the nose to collect that mucus sample, those, you know, an individual entity can run low on those, and then the county works to get those supplies out. I'm not aware of any permanent shortages where testing would not be able to happen. And so, you know, there might be a case where for an hour or two, someone has to wait on a test, or perhaps is told that the test will take place or the collection will take place the next day. But as far as a long-term shortage or inability to test, no, that is not happening.
So I have some questions for Joe with eWeb.
All right. Turn it back over to Joe. I do appreciate your patience, and while we try and keep everything as sanitary as possible.
Thanks, Jason.
If you'll repeat it. But Michael from KEI would like to know what the demand has been on the assistance programs.
Okay, so Michael from KEZI has asked what the demand is like for eWeb's assistance programs. I will say that demand is unprecedented. It's off the charts. Typically at the first of the month when we open up our limited income bill assistance program, we're able to serve somewhere between 500 and 600 customers. And that includes folks that meet the income threshold, senior citizens and whatnot. So what we did in the lead up to April 1st when we reopened the bill assistance program was we initially we doubled it from about 90,000 up to 180,000. But then as we got closer to April 1st, we started looking at some of the state unemployment numbers, and that was really spiking. And so what essentially we did is we basically tripled the budgeted amount for bill assistance from basically from 90,000 up to almost $240,000. And even with that tripling of the budget, the assistance programs for the month were pretty much eaten up within the first hour. And so we know there is a lot of people hurting out there. We're looking at different ways we can help spread our assistance around. But I will say that the demand is unlike anything we've ever seen, including the Great Recession back in 2008. So we're looking at options. We're asking for help at the state and federal levels to help our customers. And as soon as we have additional information, we'll be sharing that with you. Thanks.
So Lauren?
First, I want to apologize. I didn't introduce myself when I gave my remarks. I'm Laurelyn Spiro. I'm the Lead Communications Coordinator for the Metropolitan Wastewater Management Commission.
Michael with KZI would like to know how many times your maintenance staff has had to go in and do a removal of those materials since COVID-19 began.
Okay, so Michael with KZI has asked how many times our maintenance staff has had to go in and remove materials that I mentioned as what not to flush. Like baby wipes, diapers, fabric. So far, we've had one time where maintenance staff has had to go out and remove some items that were collected in a pump station and actually clogged one of the pumps. That's what I've been told so far. We've only had one call out to date. So I think it's because the community members are hearing our message. We had over 500 shares on Facebook about our what not to flush messaging and what to flush, and I think that's really helping, and we really want to thank community members for spreading that message. Thank you.
And we are certainly not flushing any of these wipes that we use, rather disposing them properly in a waste receptacle.
So 2 questions from Jordan at the Register Guard. The first, how many new shelters for the unhoused community has the county seen pop up as a result of COVID-19? And where can people get more information?
So the question is from Jordan from the Register Guard. How many new shelters have we seen pop up during the COVID crisis for the unhoused community, and where can people get more information about those shelters? So I know that there has been a number of shelters that have been formed, everything from a formalized setting to parking lot arrangements. I heard of one church actually pursue something where they, in their parking lot, they actually use the parking spaces as a guide, a grid pattern to be able to separate tents. So there's been a number of those. I don't think we have an accurate map for you to be able to spell those out, but I'll work, Jordan, on getting an answer for you and get back to you on that.
The second question is, what materials does public health recommend people use for a vapor barrier in a homemade mask?
So the question, again, from Jordan at the Register Guard is what materials are useful to make that vapor barrier that we've talked about being an additive to those cloth masks. What materials can people use? So there are websites that can help guide you in that process. Typically in a surgical or procedural mask, that would be a polypropyl material. But really what you're trying to get at is just something that is not permeable or is less permeable than a typical cloth fabric. So that could be anything from as simple as a paper towel to a piece of tin foil, just anything that can really cover that nose and mouth area and provide something to catch that vapor barrier and not allow it to go forward. So folks can definitely get creative on that if they understand really what that use is. I think that, Jordan, I can get you a link to a real comprehensive list that will help people, and then you can have that on your news story.
No further questions.
And that's all we have for today. Thank you for joining us.